Hello, this is a course overview introduction video for a course in hematology by the topic Diagnostic Techniques in Hematology. So what do you mean by diagnostic techniques in hematology? These are the techniques that we use to diagnose a particular disease or a particular disorder. It can be blood disorder, genetical disorder in hematology. So when we talk about hematology, we are talking about study of blood, anything to do with blood. So these diagnostic techniques basically use blood to figure out what is wrong with an individual. So this disease can either be represented as congenital diseases, genetical diseases, or any other mutating disorders that can occur, or just normal infection like malaria, anemia, name it in hematology. So there are 4 categories of diagnostic techniques used in hematology. Number 1, we have the complete blood count. Some people call it full hemogram. In this category, a blood sample is collected in a EDTA test tube or just a purple top test tube. It's called EDTA because EDTA is an anticoagulant that makes the blood that is drawn from your body not to clot after collection, so that it aids in the processing or analysis of any particular disease that is occurring. And then the next one, you have peripheral blood smear examination. You can also use the same test tube, the EDTA part of it, test tube. In EDTA test tube, you collect, let's say 3 ml or 3 microliter of blood, and then this blood you put it on a slide, then you use something called a spreader or just another slide to make a film. After making a film, this film is stained. After staining the film, we look at the shapes of the red blood cells, we look at the size of the red blood cells, we look at the size of the WBCs, we look at the shape, we look at the shape of platelets and the size of platelets and any inclusions. So if the shape differ with the normal standard shape, there are thing in hematology that is called standard operating procedure. So this shows how things should be done, and it also shows you like the red blood cells should appear this is the normal size. So anything that differ from this is a query for a disease or is a query for another abnormality. So you look at the normal size and then you look at what is presented on the slide that you have for PBF. If they differ, then you can come to a conclusion that this patient has this type of diseases. So if you are an hematologist or someone who is an expert in this field, you will know we have acanthocytes, we have blood cells, we have pencil cells, we have tear-shaped cells. So this depicts different type of disorders. Then there is something called bone marrow aspiration or biopsy, whereby a blood sample is taken from the bone marrow. So the blood sample from bone marrow is actually different from the normal flowing blood in our system, because generations of the start of blood that is produced after a cycle of 120 days comes from the bone marrow. So it tells a lot compared to the blood that is circulating in the normal system part of it. So when you look at this also can tell you, even if someone has leukemia, you can know from bone marrow aspiration. Even if someone has AML, all those type of cancers, you can know from bone marrow part of it, the bone marrow aspiration or the biopsy part of it. And then the last one is coagulation profile. You've heard of cases that someone bleeds so much, or someone the bleeding time is shorter. So those are diseases. So this coagulation profile looks at your in the system that controls the pathways, that controls the flow, the clotting time, the bleeding time within your system. So if the time is not within the normal range, then they can query a disease. So this is how you diagnose a hematological disorder. So this is a course introduction to part of the diagnostic techniques in hematology, and these are the only diagnostic techniques that are used to diagnose different type of disorders, different type of diseases. Let's talk of cancer, let's talk of diseases like anemia, thalassemia, name them. All those can be identified using these diagnostic techniques.